So sitting here, Tanisha Hood-Romo, and therapist with MHC Healthcare, working with the children's team, mainly adolescents, and working as the cultural liaison, which brings me here with Dr. Carl Roberts.
Thank you.
And we are looking to highlight a couple of the programs that he's initiated and is currently spearheading with MHC Healthcare. And we're going to talk about those two programs today.
Very good.
And go ahead and introduce yourself. And I'd be curious if we could start with maybe the Adolescent Champion model and then go into prep.
Absolutely. Well, I'm a pediatrician. I started, oh my goodness, I think I'm about 38 years into this now. So I've had a few years under my belt. And in the last several years, as my practice has aged, I became more interested in the adolescent side of medicine. And the Arizona Family Partnership, Family Health Partnership, started a program called the Adolescent Champion Program, along with the University of Michigan. And I was very interested in it, did my research, and it had not taken place yet in Pima County, so I thought, let's go for it. So about a little over a year ago, we signed up and started the program. And it has been very eye-opening, I have to tell you. So we basically, it's a system where there's a lot of education of our staff and our providers, and then making subtle changes to the office environment to make sure that our adolescents are feeling welcome here. It's been rewarding. It's been a little tough with COVID, to be honest with you. A lot of things got put on hold, but we're ramping back up again, and hopefully we'll be pretty well finished with our program by about the end of March.
Oh, that's fantastic. And currently we're sitting in January, so we're looking at, really just right around the corner.
Yeah, a couple more months.
Yeah.
So.
From what I've done in terms of research, I've seen some really amazing things that are applicable to any state. Certainly if we're working here in Pima County, focused on what Arizona has to offer in terms of confidentiality. I wonder if you could share a little bit about that, something that really stood out to me, and maybe some of maybe what's been easy or what's been a challenge?
Sure, absolutely. Well, confidentiality is a bit of a challenge in Arizona. Our adolescent patients up to the age of 17 do have some rights in Arizona. As an example, they can request birth control without parental permission. They can be tested for STDs and treated for STDs except HIV, which is one of the carve-outs that Arizona decided.
Okay.
And all of that can be done confidentially with our patient, without the parents in the room or even with their permission. Where we run into problems with all of that is that Arizona says you can do that, but the parents still have access to all the medical records. They have access to the EOBs from the insurance company, and so they see the tests on there, and so it's kind of a catch situation for us as clinicians on how we're going to accomplish those things. But what's important, what we've done here, is that when our adolescent patients walk in the office, they are given a list of those rights. It says, in Arizona, you may ask for any of these things, and we'll take care of them for you. And that's been a real boon. I mean, the kids come in and they're like, I think I need to be tested. And they know they can ask that because they've been told ahead of time. The situation with the parents is we simply ask them to leave the room so we can talk to them quietly with their son or daughter about those issues. We have to let the kids know, though, that this is going to be in your chart. This is going to be in perhaps on an insurance bill. So are you prepared for that? Have you thought about how to handle it if mom or dad say, what is this test about, right?
Sure.
So we also give them an option. We have a list of Title X clinics and things, family planning and so forth, that, hey, if you don't feel comfortable, we'll send you there. And no bill will be generated. No one's going to be contacted.
And you said Title 10 clinics, and just for those who may not be familiar with that, if you can.
Sure. Well, we have certain clinics that the government has set out that is monies are supplied for them to operate to provide things like women's health, some immunizations, STD testing and treatment and so forth. And they are run basically on an anonymous basis, so and without charge to the kids. So there are a few in town. And we give them the names, addresses, and phone numbers if they need them.
Perfect. So those resources are given.
Yeah, absolutely.
Always an option.
That's right.
That's beautiful. Another thing that really struck me as noteworthy and absolutely important enough for me to want to bring up here is there are some ages that this model is looking at. And so certainly you're coming in and saying, hey, this is important. There are certain ages that even for me, I'm thinking, wow, as an adolescent therapist, I've been encouraging individuals at the age of 13, 14, 15 to take some initiative, and this model really hits some of that. Are there a couple of those age ranges that really stand out for you that the model says?
I really, that 13 to 17, that age group is normally where if we kind of hand them the baton and say, you lead this visit today, you take control, they will do that without much hesitation, as long as they know it's a safe place, and then we're going to listen to them. Part of our training with our staff is that when the unit comes in, adolescent plus parent or whoever, the focus is on the adolescent. So you say hi to them first. You don't acknowledge the parents. You acknowledge the patient, right? Hey, Tom, how are you doing today? Hey, sign in. Here's your list, and we want you to read these things, and I'll show you later. We have some handouts we give them that's kind of fun. Tells them how to get on the Wi-Fi here, etc. Makes them just kind of feel a little more at home. If we give them that little bit of power, it seems like they take it and run. Once I hit, when my 18-year-olds and older, they function like adults pretty much now in this practice, so they kind of just know what they're doing. 13 to 17, this is a big conundrum. They don't know what it all means. What's a referral? What does it mean I'm going to get? What kind of test is that? So we try to put them in control, answer all their questions, and most of the time they will do fantastic with that environment.
So giving them the opportunity to ask the questions, encouraging them to ask the questions, and then being ready with some answers. We encourage them to take control of their health and their body and ask questions. No stupid questions here. Ask anything you want. It's okay. And again, that privacy that I keep mentioning, it's important for them sometimes to be given the privacy to do that. So whether parents like it or not, a lot of times I'll say, do you mind walking out for a while we have this discussion? And then that really gives them that little extra bit of incentive to open up and talk. That's beautiful. We take a look at some models of adolescent development, and I'm thinking very much of Erik Erikson's, stepping into initiatives, stepping into taking some autonomy or building up that autonomy. And it sounds like this really is taking all of that into accountability and making it accessible to individuals, making it accessible, as you said, to the units, to the family units.
That's our goal, right?
Wow. There's this other program that you are bringing to the table that really I'm excited about, and this is the PrEP program.
Absolutely. Well, actually, and my reason for moving in that direction as well was from the adolescent program. When some of my patients were asking me, they were coming out to me and asking me about their sexual activity, and we opened the discussion about safety and so forth, and PrEP came up. And I found myself being a little deficient in knowing exactly how to handle that situation. So I said, that's it, this is going to change. And I did a lot of research, did a full program to MHC presenting PrEP, and then I said, who's interested? Who wants to go with me on this journey? I had several, we have now a total of 4 providers at MHC that I call my PrEP core team. We
Yes.
meet, we talk, we
Yeah.
learn together.
Yeah.
They have been educated. We got our RN care partners involved. We've got the call center involved. And we really started learning how to handle PrEP properly at MHC. So I'm proud to say that that first step is done, and we are now seeing patients.
Wow.
We have been networking now with SAFE, Southern Arizona AIDS Foundation, and soon Banner Peterson Clinic as well. They are looking for primary care homes for their patients that come walking into their clinic. So to know that they could come here and not only get their primary care, but their PrEP treatment as well is huge for some of these people. It's just huge. So we're excited. We're about to go on the National Registry, which is, my heart is pounding thinking about that, because I'm telling everybody, be prepared, you may get more calls.
Absolutely,
But that's the next step. And then the future, we're not done yet. I have more to go. I want to be able to offer same-day PrEP, which is an advanced form of PrEP where we literally get some testing, medication in hand as they're walking out the door. Same-day PrEP, excellent, and studies show that it's much more effective, that we get a much higher compliance rate with that. And then I'm also working on MPEP, so that is non-occupational post-exposure prophylaxis. So this is sexual. I've had a sexual experience with someone, and woke up the next morning and thought, I don't know their HIV status. We were unprotected. What should I do? And PEP is available for that. We have time to get you in, get you treated, and then get you in a program for the next 30 days at least to make sure you're okay, and then get them in for PrEP after that. So it's 3 stages, and I think we'll make them all. It's going to take some time, but very exciting. So,
this is something that I think for a lot of us who maybe are in the know, if you can, for those of us who are not, if you can identify, so what PrEP is, what PrEP stands
Absolutely.
for, and also the having this accessible, the significance of that.
I am happy to tell you. So PrEP stands for pre-exposure prophylaxis. So what we're talking about is we identify someone who is at higher risk for acquiring HIV. Let me mention something. This all actually, came out of HHS, started a program back in 2019 to eradicate HIV epidemic by the year 2030. Right? So in 2020, this just last year, is when they really started pushing this, and PrEP is one of those pillars of that movement. So the idea is identify someone who is at high risk for acquiring HIV. Identify them before they have it. Get them on the program. And by the way, PrEP, when done correctly, this statistic sounds like I made it up, but it is over 99% effective in preventing HIV. So if you think about it, we don't have a vaccine. This is better than some of our vaccines that we have. What it requires, there's some testing up front. We make sure they don't have active HIV infection. Then, once that has been cleared, we start them on a daily medication regimen, once a day, and they stay on that for as long as they feel that they need it, based on their sexual activities and sexual behaviors. It has very few side effects, it's well tolerated. Financially, we've got pretty much all of that covered. Gilead and many of the companies provide patient assistance programs. The CDC has one, so we pretty much can cover the cost of the medication. So the good thing about MHC doing this, the reason why I'm excited, is that this isn't just a set-aside clinic that you walk into to get PrEP. What I'm presenting this as is, come in here and get all your care. Get your primary care, get all of your other health care, and PrEP will just be a part of it. Wow. No big deal. Let's just get it done. So the scoop is finding the people, getting them tested, treating, and keeping them in the program.
Whew. So this is something where, and this is MHC Healthcare really pushing towards the whole health, the whole person
Absolutely.
health. And this is making it accessible. And I think about us being, as a federally qualified health home, we're looking to meet the needs of those who may not otherwise access the care. And here we are saying we have it all under one home. You might be coming in and you might be accessing just, an annual physical follow-up, or you might also be coming in for something else, and it's not stigmatized. It's something that's
Absolutely.
open for
It's just part
whatever.
of coming in. And outside organizations like SAFE, they like the concept that this is kind of, you're going to get all your care here, because, many of their clients, unfortunately, aren't associated with primary care as well.
Sure.
So this is a great step in that direction. And geographically, MHC is pretty wide now. Like, we have a lot of locations, so we can offer this into a bigger geographic area for people that have difficulties with, say, transportation and things.
Ooh.
So right now, most of those prep programs are, south Tucson. And, that's a big distance for some of our people that are up in, say, Oracle or
Sure.
so forth, or San Manuel.
Sure.
This is going to be a nice closer, plus one of the few places that will offer it to people less than 18. That's my part in the whole situation. So that's a tricky one, because we have to go to the parents to get their permission to enroll their child on prep.
Right.
But if we can convince the family that they're participating in high-risk sex, this is going to prevent HIV, what do you have against it? Let's get it done. So I'm kind of the one that does that for our under 18 age group.
What I'm hearing you present, Dr. Roberts, is accessible care for those who may be active in life and coming up against some of the risks, and you're saying, hey, we have answers, we have care, and it's accessible.
That's right. Absolutely.
Thank you.
Yeah.
Thank you so much for your time, Dr. Roberts.
Well, you
and
bet.
Thank you so much
you.
for
It's been a
sharing all
pleasure,
this
Tanisha.
information for us.
Yeah, absolutely.
Thank you.
Thank you.